The Vermont legislature has adjourned, but they'll be returning on June 21st to deal with Governor Phil Scott's vetoing of the budget as well as education funding. It's been a relatively quiet session for the VMS with a new governor, new House and Senate leadership, but we've achieved some significant victories for Vermont physicians and their patients. Proposals to require mandatory CME on marijuana registries, proposed cuts to the Medicaid fee schedule were both defeated, and the bills that we introduced have all passed. In all, we're looking forward to continuing working with the governor. He just announced the appointment of 2 members to the Green Mountain Care Board. The chair, Senator Kevin Mullen, is somebody we've worked with closely and look forward to a close relationship. On a personal note, the search for my replacement as Executive Vice President is going smoothly, and I've been informed that there are some highly qualified candidates, so the VMS should continue to have a strong staff representing physicians and their patients.
VMS had several legislative successes this session. One is S14. That is the bill that VMS introduced to expand our Vermont Practitioner Health Program. Traditionally, that program has been limited to serving physicians, physician assistants, podiatrists, and others licensed by the Board of Medical Practice who have substance use disorder. S14 will allow the program to expand to serve any Board of Medical Practice licensee who has a condition that impairs their ability to practice medicine with reasonable skill and safety. So that could include mental health and other behavioral health conditions. We're very pleased that this bill has been signed into law. It is Act 39 and goes into effect July 1st of this year. So the VPHP program is in the planning stages of working to implement that expansion. Another bill that passed this year that VMS was very involved in is S3. That is a bill that relates to when mental health professionals have a duty to warn if their patient poses a risk to other members of the public. And there was a Supreme Court decision issued in the past year that greatly broadened when mental health professionals, including psychiatrists, might have a duty to warn. And that expanded duty posed a risk to patient civil rights and confidentiality and was of grave concern to hospitals, patients, caregivers, psychiatrists, and others in the mental health profession. And VMS led a coalition, a really broad coalition of other organizations and individuals across the state that successfully accomplished the passage of S3 that limits the duty to what had been in Vermont law for decades in the Supreme Court decision of Peck. So the standard goes back to the Peck duty, which is well recognized by psychiatrists and other mental health professionals. And we are very pleased with that outcome. And that bill has been sent to the governor's desk, and we expect that it will be either signed or go into law and will be effective on passage. A third bill that passed this session, which was supported by the Vermont Medical Society, is S50. This is a bill related to telemedicine services. And the bill will expand the requirement that insurance companies reimburse for telemedicine services. And what it does is allow the patient to not just be located in facilities, but the patient will be able to be located at home, at work, in other locations, and insurance companies will reimburse for that service. That had been in effect only for primary care services, but now will be expanded to any type of service that the insurance company already is covering in that individual's health care plan. So we are pleased with the passage of this bill and expect that it will increase access to care, especially in rural areas of the state or limited specialties that have limited access, so especially mental health areas, geriatrics. We heard from psychiatrists and other physicians about new telemedicine programs and how this bill will help increase reimbursement and increase the implementation of telemedicine around the state. So we are, again, very pleased with the passage of S50, and that has also been sent to the governor's desk, and we expect it to it'll be implemented as the health insurance plans renew for the patients covered by those plans.
Public health issues this year in the session were a bit emotional and like a roller coaster, but we worked hard this session on Tobacco 21 legislation to raise the age of tobacco to 21 from 18. And unfortunately, it didn't make it through the Senate, and I think our plan going forward with our coalition members is to hope to bring it up in the House next year and continue to work over the summer to educate legislators on that topic. I do want to thank everyone who called their legislators and wrote to legislators and testified on this important topic.
3, 2, 1.
The push to legalize marijuana took a number of twists and turns this year. It started in a standalone bill. The Senate added language on a number of bills, but it did end up on a bill S-22, which was a bill discussing fentanyl. It ended with legalizing an ounce for possession and growing of 2 plants. It did pass both bodies and ended up on the governor's desk, and he chose to send it back to the legislature with a number of key points that he really wanted to see in legislation, which he did talk about from the beginning, which are protecting children, transportation and highway safety, and pushing the commission out. So that could be brought up again in the special session in June. We will keep watching that and let you know what's happening.